Welcome back to Fox 11. Time to check in with Dr. Ernst von Schwarz, get the latest on the pandemic both here in the United States and around the world. So much changes every time we talk, Dr. von Schwarz. Thanks for joining us. Let's start with variants here in the U.S. and specifically in California. The UK variant was found for the first time in Santa Barbara County just this week, and these California variants we keep hearing about as well. What do we know about them, and do the vaccines work against them?
Well, we don't know much about them. With regard to the California variants, we know that they probably have a 20% higher transmissibility than the older variants, maybe even higher than the UK variant. So far, we really don't have any data on the efficacy of the vaccinations, but it's supposed to work even against those variants, maybe a little less effective than compared to the older variants.
It's interesting. And the UK variant, I guess, is the most prominent one that we're seeing when it comes to variants in the U.S. For us to be seeing it so little here in California, does that mean that there's more of the other local variants here?
It could be, but not everyone is tested for the variants. There's not genetic testing done all the time, of course. We see actually more of the UK variants now coming. If you look for it, we'll see more. In certain European countries, I mean, the UK variant is now the predominant mutation to be seen.
We'll get into Europe in a second with AstraZeneca, but let's talk about Moderna testing on younger children. Could be a game changer when it comes to getting more younger people vaccinated. What do we know about that?
Well, as you said, Moderna is testing now children as young as 6 months to 11 years with their vaccine, which is brand new, of course, because the currently available vaccines are only indicated and approved for adults the age of 18 and over, except the except the Pfizer vaccine that's indicated for 16 plus older. But we don't have any data on children. The only new data was actually just yesterday that the first baby was born in Florida who had antibodies against the coronavirus because the mom was vaccinated, and the antibodies were found in the umbilical cord blood. So that's something good to know.
That is really, really interesting. Yeah, that is fascinating. All right, let's talk AstraZeneca. There are so many questions about this vaccine that's being used throughout Europe, but they've pulled it in a lot of cases from many different countries, and we'll put a map up showing all the countries that have stopped using it, at least for now. Why are they doing this?
Well, there were some questionable reports whether the AstraZeneca, which is an adenovirus vaccine, is associated with the development of some relatively rare brain vein thrombosis, meaning clots in certain areas of the brain vasculature. So the EMA, which is the European Medicines Agency, the European FDA, if you wish, as well as the World Health Organization yesterday, both put statements out that, number one, there's no evidence of a causal relationship between the vaccination and the formation of those clots. And secondly, they also issued like a warning to inform recipients of the vaccine that there might be a risk, even though it's not proven. But thirdly, and most importantly, both agencies stated clearly that the benefits of the vaccine outweigh the risks. So most of those countries actually have restarted using the vaccine as of today.
There is a spike, a surge in cases once again in Europe. You and I were talking during the break. 28,000 new cases yesterday, is that right?
Well, in Germany, for example, where I'm from originally, I mean, they had 28,500 new cases diagnosed yesterday. That's 5 times the numbers 1 month ago. We don't see that right now in California. We had like 3,500 new cases yesterday. So our numbers go down, but in Europe, they are all scared of the 4th wave. And keep in mind, they don't have in most countries, not the amount of vaccinations available we do have here. And people are panicking now. They're scared of the 4th wave.
Is there a possibility that, I feel like we kind of follow Europe several months later, are we just so far ahead in the vaccine effort that we probably won't have the problems they are?
Well, I'm not sure about that. I mean, so far, 1 in 8 adult Americans have been fully vaccinated, which is good, which is a great number. But we are, of course, a little concerned what's coming up with spring break, with certain states not using mask mandates anymore. So it's definitely not over. Our numbers look promising right now, but let's see what's coming.
Dr. Ernst von Schwarz, always a wealth of knowledge when you join us here on Fox 11. Thank you so much. We'll check in with you again next week.